It may have taken the death of a celebrity for the public to sit up and take notice, but law enforcement realized long before Philip Seymour Hoffman's overdose that Massachusetts has a heroin problem. In less than 2 months, police in Taunton responded to 64 overdoses, including 4 this past Saturday. Brockton police reported 5 ODs last weekend, 2 of them fatal. And Attleboro cops say they now get at least 1 overdose call a day, up from 1 or 2 a month. A spokesman for the state police says just about every county in the state has seen a spike in overdoses in recent weeks. As part of our in-depth focus report on heroin, we've examined the dangers of the new heroin laced with the prescription drug fentanyl, and we've learned how Narcan can reverse the effects of a potentially deadly overdose. Tonight, we're looking at treatment options for addicts. We've heard from viewers concerned about access to rehab services, including Jim, who writes, "If Narcan brings an addict back from the dead, but there is no space for him in treatment, little has been accomplished." So is there really a shortage of rehab facilities, and what does it take to overcome heroin addiction? My first guest knows firsthand. John Cohan is a recovering addict who abused heroin and other opiates. He's now an addictions counselor at the Outpatient Treatment Center, Right Turn. Welcome, John, to Greater Boston.
Thank you, Emily.
So is there a difference between being addicted to heroin, other kinds of prescription drugs, alcohol, and is heroin harder to kick?
Not necessarily. I think people want to separate prescription opiates and heroin, and it's really the same class of drugs, and it's the same symptoms of withdrawal, and it presents pretty much the same challenges in treatment. And
what worked for you?
What worked for me was a combination of treatment and self-help groups and daily maintenance.
How long did it take?
It took some episodes of relapse for me, and it took, I'll be coming up on 7 years.
Wow, that's good.
Mm-hmm.
And was there a drug intervention that you used? Was there something that weaned you off of heroin or opiates?
For a very short time, it was when Suboxone first came out, and I was on that for 2 weeks, I believe. But it's important to know that, the treatment does work for people, and we find that some of these medications are wonderful, and if used in a proper setting, in a proper clinical setting, combined with counseling and other types of treatment, it's successful. It's not impossible to come back from opiate addiction.
We did a profile of you and your agency on Tuesday, and Gail Huff was over there. So have you seen a big spike yourself in people coming in, or is it pretty much the same?
It's pretty much the same. What we're seeing, every clinic is different, but what we see is kind of middle to upper class kids from the suburbs. I know that in the last few years, there seems to be many more that are younger, and they're starting out earlier, and they're taking prescription opiates, might get them from mom and dad's medicine cabinet, and they can't afford them any further, so they go to heroin.
All right, let's bring in another expert. Dr. Christine Pace is an attending physician at Boston Medical Center and a board-certified addiction specialist. Welcome to Greater Boston, Christine.
Thank you.
Do we have enough facilities to treat all these people? I mean, it seems like there's so many out there, and then there's the ones who haven't even tried to seek help yet.
I mean, I think as a physician, my perspective tends to be about the availability of medication-assisted treatment, which is a really important treatment option for patients with opioid dependence. And it really can help many patients with opioid dependence reach recovery. And I think we really don't have enough medication-assisted treatment available for people in Massachusetts. Almost all Suboxone programs have quite extensive
What is it called?
Suboxone. That's buprenorphine, which is the medication that John mentioned, which is partial opioid agonist, so it's a sort of alternative to methadone maintenance or to naltrexone treatment for opioid dependence. And wait lists are often months long, and so for patients who are really in crisis, that can be a very risky and really heartbreaking lag in treatment.
So what happens to somebody who tries to do it on their own? We heard from a mother who lost her son 3 years ago. He tried to break his habit by himself and then relapsed and took an overdose and died. But is it possible to do it on your own?
So I think I think the rare person can do it on their own. I think at the very least, most people need a lot of psychosocial treatment, meaning counseling and or self-help groups and or extremely supportive communities. But we know that medication-assisted treatment like methadone, like buprenorphine, like naltrexone, which is also known as Vivitrol, can increase the rates of recovery for many patients with opioid dependence. So not everybody necessarily needs it, but it's a really important tool.
So Faulkner Hospital tried to shut down a large part of their rehab facility about a year ago, and Mayor Menino and others, pushed back, and they ended up only closing a portion of it. Was it strictly the economics of it, insurance reimbursement? Because that's actually changed with new healthcare policies. But why would they do that?
My understanding is that what they were shutting down was their detoxification facility, or reducing the number of beds available for detoxification. And I think the perspective is that detoxification is not treatment. It's a gateway to further treatment. But really no one's going to get better just from 7 days in a detox facility. And so I think their focus was to try to switch their treatment efforts to more of the outpatient setting. I think we really do need the full spectrum of care, including level 4 sort of medically intensive detoxification treatment. But I think that was their focus, and then what was lost.
So, John, I know it's a process and you're still going through it, but start to finish, how long would you say it took before you felt like, I'm going to make this, I can do this on my own without being in a facility, without a drug intervention?
It is a process. So the idea of doing it on my own or being out in the community is different for everybody. For me, I was in treatment 45 days. That might have been too short. And the problem, you mentioned insurance, but the problem with a lot of insurance coverage for detox and rehab treatment we see is that it's just ridiculously short. There's no way that people can go into a 3-day detox and call that treatment and be able to really have some tools to fight this disease. So we're hoping through this, all the media attention that's happened recently on opiate abuse, is that we're hoping that this is going to open a conversation and make more treatment available throughout the country, but especially in Massachusetts. Was
it physically painful for you, as well as psychologically?
Yeah. You're fighting a mental and physical battle that it's very difficult to describe to somebody, but it's a difficult journey. It's often marked with relapse, but it is absolutely doable, and there are thousands of us who are living lives in recovery.
What do you do, Christine, about the people who really don't want it? They haven't sought it. They're not, they're going to services. They're getting clean needles and that kind of thing. But I was at a clinic last week. They were streaming in and out. They weren't seeking help. They were seeking help getting clean needles to use. But,
I mean, I think harm reduction is really crucial, and so that includes clean needles. It also includes prescribing Narcan, inhaled Narcan to patients. Or
they don't want that either.
Okay, or in that case, potentially making sure their families know where to get it, because ultimately it will be their families and friends who use it. And as a primary care doctor, I think there's really an opportunity. My patients who are still using come to me for their medical care. They may come to me to talk about harm reduction. They're not seeking treatment. But I continue to see them over the months or years. They know I'm available. They know that I can help them get into treatment when they're ready. And I think it's support and persistence and just being there for them, really, that is all we can hope for at this point. And continually using techniques like motivational interviewing to try and get them ready to change.
All right. Well, good luck to both of you. Christine Pace, John Cohan, thanks so much for coming.
Thanks,
good luck
Emily.
to you.